So chronic inflammation has become tied together very closely with clonal hematopoiesis in general, not just in MDS or MPNs, but even in patients with these precursor conditions. And what we think is happening is that some of the clones that develop typical mutations are actually pro-inflammatory, or at least their progeny have a hyperinflammatory state, where they release cytokines that change the environment in which the stem cells live and perhaps gives them a selective advantage. In other words, these cells that not only create this inflammatory environment, they also prefer that environment and thrive in it compared to the normal counterparts. So that could be one mechanism for the clonal expansion of these clonal hematopoiesis clones. Now, when a patient develops MDS, it's typically characterized by cytopenias, usually anemia, and we have known for a long time that chronic inflammation can suppress normal bone marrow function. So we have now begun to learn that patients who have lower risk MDS in particular tend to have higher markers of NLRP3 activation, which is an inflammasome that leads to increased inflammatory signaling through IL-1 beta, IL-6, and others. And that by itself may be driving down erythropoiesis and causing anemia. So imagine if we could target just the inflammatory portion of that disorder. Even if we don't affect the clonal portion of it at all, we might already improve the anemia that these patients experience without having to give a cytotoxic therapy or something else like we do for the higher risk patients. So there's a lot of investigation into modulating the innate immune system through either NLRP3 inhibition or IRAK inhibition or other potential targets that could significantly change the severity of disease that patients have and avoid more toxic therapies that they might have to get otherwise.